something that we're loving in aesthetics right now?
Ooh, this is a good one.
I know.
Yes.
I
Well,
know.
gosh, there's so many, right?
I know.
But for me, I would say we've talked a lot about it earlier is regenerative aesthetic medicine, just because I think we're at the forefront of a lot of things happening, more research and evidence-based information about how we can start to incorporate this more. So I'm excited about that.
For sure. Jess?
I think something that I have been seeing too with over the last couple of years, especially now, is a hot topic is a lot of the weight management and GLP-1 drugs that are coming out. There's so many different brand names, and I think
Wink, wink.
Yes.
We all know what we're talking about.
Depending on what hands of a provider that you're in, I'm seeing more of like a pandemic of patients that are having not only facial fat pad loss, but like some structural loss. So combining multiple modalities, I'm always going to come back to that because you treat the face from a holistic perspective and as a unit. I love pairing sculpture or biostimulators and dermal fillers. I know I talked about this yesterday at a training with Heather Rippian, and we were like going off about it, how it's just such a balancing act. And when you pair the two together, patients truly, like they see it, like
Yeah.
they're happier because you're not coming back to that like target treating or spot treating. You're treating the face as a whole. And patients look more refined and elevated and natural.
Yeah.
That's the goal. Natural.
Again, though, that like wow factor where they're like, oh, I get it. Like that's like the most satisfying thing I find with patients when they're like, I get it, I see it, like I
Yes.
believe
So
in
the
it.
secret sauce is a combination.
Yeah,
Yes.
for sure. Yeah.
Yes.
Casey, what have you been loving lately?
Back to the lower face neurotoxin.
Yeah.
I think there's missed opportunities, and when treated right, it can just be a game changer
Yeah.
for like those depressor muscles in the neck, appearance of the necklace lines, and even like the frowning face, resting
Yeah.
face.
Is that your favorite muscle to treat down there?
I do love DO treatment. I love the mentalis to the chin when you
Yeah.
get that like orange peely look.
The,
and
like,
just
dimples.
quieting. Yes.
I'll tell
And
you.
the one thing
Go
too
ahead.
that is important as a consumer to know is that it's like a good partnership or relationship. One complements the other. So dermal enhancers, refiners, love that term again, is in combination with neuromodulators, it will extend the life of the hyaluronic acid or other, agents like even sculpture, because you're not working, those muscles aren't working so much over time. So when we educate that way too, I think people really get it.
Yeah, for sure. Well, something I've been loving.
You, Sarah.
I've really been liking, I feel like I've been seeing a more natural approach to things. I think we kind of like touched on that earlier, but just not like, just such the extremeness of it. And then I feel like it's in turn like people aren't as like scared of aesthetics. Like I do feel like there is like a level of fear. And, so, sometimes it's good to have like a healthy dose of fear. I feel like especially if patients are expressing like concern, they're like, well, I don't want to look crazy. And we're like, we don't want to make you look crazy. like I get it, like I don't want to look crazy either. So I've been loving seeing that. I feel like even with celebrities, and that could be with more awareness to our field or knowing what's good and what's bad.
And I think something being a younger injector, patients are always so shocked to find out, like, I have 8 syringes of filler in my face. They're like, you do?
Yeah.
Where? And I'm like, they were like, you look so young. You look so like youthful. I would have never guessed, because it's all about, like to Dawn's point, who's behind the syringe. It's not always the product. It's the placement. It's the intention.
Right.
It's looking at the face pan facially and as a unit, holistic approaches.
But
And
is that not the best compliment where they're like,
yes,
you do?
yes. And I'm like,
Yes,
yeah,
I
girl.
do. And you can have it too.
Yes. Let me show you the way.
Yes, please come. Let me show you all the magic that we have.